Without saying a very big thank you to Mrs. MarieStopesNG. Madam, you are an asset to the state, you are an asset to humanity. I personally appreciate you. Thank you.
Thank you very much, Barrister Eugene Uzum. And I can say this about the Bureau for Orientation. Anything that gets to them gets re-echoed, and be assured that the entire populace of Delta State would hear about it. Ladies and gentlemen, before we come back to the list that I have, I want to quickly bring on the man who said the opening prayer. He has a goodwill message. I'm talking about Reverend Dr. Godfrey Onyawoli. Please, you have 2 minutes. Immediately after him, we'll take on the representative of the Secretary to the State Government, and then we'll come back to Reproductive Health Group, and then we'll cap it up with that goodwill message from TCI.
Good afternoon, everyone. Standing on the existing protocol, and I want to get you informed about Delta State Interfaith Forum, made up of the Christian faith and the Muslim faith. By the grace of God, State Ministry of Health, in collaboration with TCI, gave birth to this body in order to address the issues of reproductive system, reproductive issues and family planning, as it were, in our religious circles. And ever since this was given birth to, we've been doing that campaign to ensure that avoidable deaths within our region, within our circle, is by all means and to a very large extent reduced. So that is what Delta State Interfaith Forum stands for. Thank you.
Thank you very much. The man who led us in the opening prayer. My colleague will take over from here.
Thank you so very much. Still on goodwill messages, would like to take the goodwill message from the Secretary to the State Government, who is ably represented by Mr. Onyeluka Igbonoba, the Executive Assistant, Special Duties. You're welcome, sir.
Good afternoon, ladies and gentlemen. Please permit me to stand on the existing protocol. First and foremost, I want to say a very big congratulations to this wonderful organization, highly focused organization. Maybe we have forgotten that this organization is 100 years today. So it's actually their centenary year. It is not so easy to get an organization running for 100 years. Precisely 100 years ago, the founder of this program, MarieStopes, established a clinic in UK focused on pet control. One more thing I would like to say here is that if you create an establishment, an organization like this that tries to be several steps ahead of society, then you have an enormous job to do when it comes to sensitization. If you sensitize very well, if you sensitize the society very well, a whole lot of people will key into the vision of this program and benefit from it. Thank you so much, and God bless you.
Thank you so very much, sir. Just to also say that we are working closely with the Primary Healthcare Development Agency, and we have representation from here today, and words, of course, from the Permanent Secretary of that agency. If you're here and you're yet to get vaccinated, to receive the COVID-19 vaccine, I'm a strong advocate. This is just a free advert to remind you to please take advantage and get vaccinated. We're no longer running a shortage of the vaccine, so we're sure that we'll have vaccine to go around as we move on. So please get vaccinated. And in that spirit, I'm going to invite to the microphone for goodwill message from the representative of the Permanent Secretary, Primary Healthcare Development Agency, Delta State, Dr. Paul Yinkore. Dr. Paul Yinkore, he does this in brief, so rest assured that he will do this in brief. You're welcome, sir.
All protocols duly observed. I want to appreciate all partners sitting here, and especially the government of Delta State. I can see my peers, Dr. MarieStopesNG, thank you for being here. And I want to appreciate MarieStopes for doing what they are doing. I think currently some of your programs are now in my department. And I think this is coming at a very auspicious time that the family health and also reproductive health services or units have been moved to my department. Our hands are open, we are ready to work with you. I want to appreciate everybody that is here. Thank you.
Thank you very much, Dr. Paul Yinkori, for keeping that 2 minutes limit given to us. Ladies and gentlemen, we will now want to call on the Association of Reproductive and Family Health representative if they are here. Association of Reproductive and Family Health, are they here? Okay. Someone is coming? Oh, wonderful. Immediately after this, we will call on the representative, and that will be the last, I think, for this bout. It will be coming from the Challenge Initiative. Okay, finally for now, please, let's welcome to the microphone Mrs. Wanne Kalu from the Challenge Initiative, TCI.
Good afternoon, everyone. I want to stand on the already existing protocol. I work with the John Hopkins Center for Communication Program on the Challenge Initiative project. We've been here for 4 years, and we've worked closely with MarieStopes as in the family planning space. So we're happy to be part of this big event, and we give it all our support. We believe strongly that since it is what we are all working for, that we will give all our support in any way that we can as partners. Nationally, our people also relate at the national level. So in the state, we are also relating very well in the state level. And I know that it is going to be very, very, very successful. And women, young girls who are our target beneficiaries shall be the best for it. Thank you.
Thank you very much, the representative of TCI, the Challenge Initiative. Ladies and gentlemen, I believe the goodwill messages will go on and on even after now. I believe groups and individuals will give their testimony and messages of goodwill to MarieStopes as the time goes on. We would now want to we'll move on to the next item on the program, which I think is the high point for this afternoon's occasion. It will be the remark by the Permanent Secretary of the Ministry of Health, who is here represented by the Director of Medical Services and Training, DMST, Dr. Chris Iwebu. That will cascade into the commissioning of this edifice. Ladies and gentlemen, please let's welcome, standing in for the Permanent Secretary, Dr. Chris Iwebu of the Ministry of Health.
Good afternoon, ladies and gentlemen. The Permanent Secretary, Dr. Ejiro Odenaga, intends to be here. When I met him this morning, he still told me he was going to be here, but although he knew he was going to have a meeting in the government house, but I'm sure he was not expecting that this meeting was going to last this long. So I've just been told that I can stand in for him, so I have his address. So, with your permission, I read the address for you. It is a pleasure to be at this landmark occasion, the launch of MarieStopes Medical Center, Sabah. On behalf of His Excellency Governor Ifeanyi Okowa and the good people of Delta State, I welcome you to the state. MarieStopes Nigeria is a good and collaborative partner in the state and currently supports about 60 primary healthcare facilities across the state. I've trained over 150 from 2015 when the organization commenced major intervention and partnership with our public sector facilities. They have also supported the private sector providers in the state through their social franchise model, tagged Blue Star, which commenced in 2013, and they provide a pathway for quality family planning services for over 40 of these facilities spread across the state. MarieStopes, I can confirm, is working collaboratively with the Delta State Contributing Health Commission to take over, upgrade, and manage some PACs under the public-private partnership scheme. MarieStopes has been instrumental in strengthening quality standards within the Delta State health system. Their support has covered provider capacity building and competency assessment with over 150 providers trained by MarieStopes on contraceptive technology, strengthening supportive supervision and data quality and reporting, while enabling sustainable demand generation for services through community mobilization. The opening of the MarieStopes Medical Center Asaba is another milestone and contribution that will expand access to quality and client-centered healthcare delivery, especially for women and children. The Delta State Ministry of Health appreciates the contribution of MarieStopes Nigeria to the development of healthcare in the state and calls on the organization to sustain this productive collaboration. Thank you very much. It is on this note that I, on behalf of the Permanent Secretary, commission the opening of this new edifice in MarieStopes Medical Center. Thank you very much.
We can do better. The Permanent Secretary Ministry of Health, represented, has just commissioned this edifice to the glory of God. Now, gentlemen of the press, please, we will be taking the cutting of the tape after now. We want to ask that a few of our dignitaries would accompany the representative of the Permanent Secretary and the Country Director of MarieStopes to where we have the tape. We want the Chairman of the Commission and the DG. We want the DG Orientation and his Permanent Secretary, the Permanent Secretary, Ministry of Health, and as representative of the Secretary of the State Government and directors from the Ministry of Health to please proceed to the spot where we'll be cutting the tape, please. The Permanent Secretary, Ministry of Environment, please. And the President, Medical Women's Association of Nigeria, please join us. Immediately after the tape is cut, we will crave your indulgence that the persons so mentioned will go in for the tour and come back out to join us.
I have to be somewhere else.
Okay?